In this replay, we're bringing attention back to a critically important topic, cholangiocarcinoma. While it's considered a rare cancer, it isn't rare to the patients and families living through it every day. And it certainly isn't rare to us as private patient advocates, especially myself. This episode sheds light on early symptoms, treatment challenges, and how advocacy can make a life-changing difference. Let's listen. Welcome to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're discussing a rare but aggressive type of cancer called cholangiocarcinoma, which is also known as bile duct cancer. February 20th is World Cholangiocarcinoma Awareness Day, and this cancer is one that I especially have a deep personal connection to. My brother, who was also my best friend, recently lost his battle after 7 years of a strong fight with cholangiocarcinoma. This journey really opened my eyes to just how complex and flawed our healthcare system really can be, including delayed diagnoses, miscommunications, medical errors, which really all made the process even harder than it already was to go through. That's why having a private patient advocate is really important. And this is why I chose this topic for today's podcast. And it's really important not only with cholangiocarcinoma, but when you have a rare disease such as cholangiocarcinoma, it makes it so much more challenging to go through by yourself if you don't have a private patient advocate. And so today, Christine from our team will be joining me. She will help guide our conversation as we break down everything that you need to know about a rare cancer like cholangiocarcinoma and why a strong private patient advocate is needed. So, hi, Christine. How you doing?
Good. Hi, everyone, and thanks, Elena. I know this is such, a personal and important topic for you, and I'm honored to be part of this conversation. And for many people listening, this may be the first time they are hearing the word cholangiocarcinoma. So let's start with the basics. What exactly is cholangiocarcinoma?
Good question. So, cholangiocarcinoma is also known as bile duct cancer. It's a rare and aggressive cancer that affects the bile ducts. So, those are the tubes that connect your liver and your gallbladder and your small intestine. Since the gallbladder is connected to the liver, it's often classified as a type of liver cancer. And despite it being rare, cholangiocarcinoma is now the second most common liver cancer worldwide. And unfortunately, cases and mortality are actually
Mm,
increasing. This cancer is especially tricky because it often presents with very vague symptoms. For example, jaundice, which we know as like yellowing of the eyes and the skin, unexplained weight loss, abdominal pain, itchy skin, maybe some digestive issues or change in the color of your stools. And so there's usually, you could have abdominal pain. A lot of times it's painless. So, painless jaundice is often a red flag for cancer unless it's proven otherwise, but it gets overlooked so many times. And even in the instance in my brother's case, he was misdiagnosed, and I really had to help him push to get evaluated because he had painless jaundice and his symptoms were not initially spot on, and it really delayed a lot of things in the beginning. And I see this happen so many times when I have clients come to me and they're telling me their story. And so unfortunately it happens more often than we know. Because the symptoms are nonspecific, many people aren't diagnosed until later stages, which makes treatment much more challenging.
that's really heartbreaking. Since the symptoms are so general, does that mean cholangiocarcinoma is often misdiagnosed?
Exactly, it does. And in my brother's case, his diagnosis was delayed by over a month, even though we were persistent and asked questions and pointed out clear symptoms. I mean, it was it was
Yeah.
shocking how it was missed so much. And he had somebody advocating for him. Like, imagine if you didn't from the start prior to diagnosis. A lot of
Exactly.
times it's missed until the patient is severely advanced. Some of our biggest challenges in diagnosing cholangiocarcinoma include healthcare providers are unfamiliar still with this disease because it's rare. Many providers don't recognize the early warning signs, or they are kind of masked by other symptoms and diagnosed with something else instead. Also, delaying imaging and testing. Many patients go through multiple rounds of testing before getting
Right.
the correct diagnosis, and this was huge, especially in my brother's situation. I had to push and push and push for a proper imaging because the imaging that they were doing was showing some abnormalities, but not enough to diagnose it. And diagnosis is of course key because once you have a diagnosis, then you can start talking about treatment and management. The next thing was miscommunication between the healthcare teams. Different specialists may not be coordinating properly, leading to missed opportunities for early intervention. I know specifically in his case, there was like hepatobiliary surgery, not agreeing with pathology. They had different plans of how they wanted to evaluate and diagnose to see if it was cancer versus inflammation or something else. And then we had, infectious disease, their input, and different other specialists. So it was very challenging. And I know, for example, I would be um, not at the hospital. This was like in the early stages, and I would get a call from my brother, and he would say like, "Hey, they said they want to take me for a procedure," and I was like, "A procedure? What?" And then he'd be like, "Somebody called and just came in again in my room and canceled it, and now they want to do something different." So for like the patient, it is so confusing because you have all these people coming in, and they don't seem to be talking to each other. And unfortunately, this happens so commonly. There's so many reasons that it happens, but the reasons don't really matter to the patient. It's just unfortunately poor care and poor communication. And so it was just very overwhelming for the patient, but it required a lot of navigating for sure. By the time many patients are diagnosed, the cancer is already in advanced stages, making it harder to treat. And that is really why patient advocacy is so important, to push for answers, second opinions, proper testing. With rare cancers, usually the disease is fairly advanced by the time of
Right.
diagnosis because it's often missed. So for cholangiocarcinoma, often the 5-year life expectancy is like less than 3%. So it's quite aggressive.
Yeah, imagine if you're not there to advocate for your brother back then. It must be really difficult for them, right?
Yeah, I mean,
Mm.
I think the whole process is challenging
Yeah.
no matter what, but if
Mm.
there's a way to make it less challenging, why not do it
I
with a
know.
private patient advocate?
Yeah. Well, you've experienced this both as a medical professional and, as a family member. From your perspective, what are the biggest challenges patients and families face when navigating this diagnosis?
That's a really good question. And there's so many challenges, but a few of the biggest ones are, first of all, being told that there's nothing more we can do. And this happens countless times with my brother, with so many clients that we have. And even when there's still treatment options available, you often get that, oh, yeah, we don't know. There's nothing more we can do. There's unfortunately many providers and people that you'll meet that they just don't want to go that extra step to try to kind of go outside of their algorithm or help figure out what's going on. And of course, not everybody is like that by any means. There's, people that do sit there and take the time, but you're going to meet a lot of people like that during your journey, and it can, emotionally overwhelm you. It can make you feel defeated. It can make you feel like, wow, like I literally have nothing left to fight. There's nothing to fight for. And you don't want to be like that because you don't have to be. That's not how it should be. The next thing is medical errors and miscommunication. We were told once that surgery wasn't an option, but that turned out to be completely false. A surgeon had already reviewed the records and approved the surgery. And as I was coming in to explain that in the room, we had a different provider that was like, oh, yeah, there's nothing we can do. Just
Yeah.
unfortunately, it's going to be a couple months and
Oh
that's all you have
gosh.
left to live. And it was just very blunt and misleading. It wasn't actually
Yeah.
true. So you always have to kind of I always encourage getting second opinions, third opinions, whatever you need. But this is your life or your family's life, or your loved one's life.
Exactly.
So
Yeah.
never not ask questions is what I always recommend. The third thing I would say is finding the right team. Not every doctor, not every specialist, not every provider is experienced in treating cholangiocarcinoma or whatever your rare disorder is. So getting to the key specialized center and provider is key. And maybe it depends on, one specialized provider could maybe have more experience in one treatment that would work best for
Yeah.
you than another one. So don't assume just because, oh, wow, they treat this specific type of cancer that I have to go to them, because they're
Mm.
not the only one out there. And maybe that treatment's not going to work for you. Or maybe you just don't have this like trusting relationship with that provider. So that's important. It really is. The next thing is emotional and logistical, like stress. And this is so important and unfortunately it gets overlooked. The process
Yeah.
is really overwhelming, and keeping track of appointments, medication, test results, it can feel like a full time job. And that's the last thing a patient or
Yeah.
their family members really should be doing, because it's so emotionally overwhelming. Why are they being stuck with these, you know, clerical, administrative, logistical type things at the worst, emotional time of their lives? And unfortunately, today's day and age, you can't rely on healthcare systems or doctor offices to do it, because they just don't have the setup for it, and it's just too busy. There's not the logistics in place to
Right.
accurately carry it out.
Yeah.
And so this is, I mean, Christine, this is, I guess, where I would say a private patient advocate comes in. We help ensure that these things are addressed and covered so that nothing falls through the cracks. Every treatment option is explored. Families can focus on spending time together instead of dealing with logistics.
Yeah, exactly. I know this information is really helpful, for so many people that has been dealing, with any type of chronic illness, cancer or whatever. But now, how exactly can a private patient advocate help someone with cholangiocarcinoma or any diseases?
That's a good question. So, a private patient advocate really acts as a liaison between the patient, their family, and the healthcare team. And here's an example of how we at Pathway Patient Advocates help. So, keeping track of medical records, appointments, we make sure everything is organized and accessible, especially when you're going to different providers or second opinions. You need accurate, concise information readily available, because time is so important in this situation, and you don't want to waste time or give inaccurate information, because very often you only have a very limited time to be in front of this specialist or make this decision, and it impacts the following decisions you're going to make. The next thing is coordinating with the specialist, making patients or excuse me coordinating with the specialist. Many patients need multiple doctors and specialists and second opinions and so forth, and different treatments, whether it be a clinical trial, whether it be radiation, chemo, combination, immunotherapy, further testing. I mean, there's so many things. And so we make sure that everyone is on the same page. And, when those providers don't have time to talk, which unfortunately happens often, the information is getting relayed that needs to get relayed. And we are on top of it to ensure that that happens. The next thing is really speaking up and advocating and asking the right questions. We challenge medical errors. We ask about trials. We push for, newer treatments when needed, and newer second options when necessary. We're not afraid to ask the questions, and we encourage our clients to not be afraid either. Again, like I said earlier, this is your life. So if you're not going to ask the right questions, or, when are you going to ask them? And then the other thing is providing emotional support. Families often feel alone in this journey. And I also will say that the patient often feels like their cancer or condition is like a burden to their family and loved ones. And it makes them feel almost like a sense of guilt. And so I think it's great that we're able to help alleviate that, because having an advocate means that they don't have to navigate it by themselves, or their loved ones don't have to navigate it fully on their shoulders. And so I think that's a really important aspect that's not always like brought up or discussed.
Yeah, for anyone listening who has a loved one with cholangiocarcinoma or any serious illness, what is the most important piece of advice you can give them?
So I would say never accept there's nothing more that we can do at
Yeah,
face value.
that's
Now,
important.
I say that because I think that's important to remember. Of course, you have to look at quality of life. And I always bring this up like, what's your quality of life? What quality of life do you want? Is this treatment or recommendation going to give you the quality of life that you want? Weighing your pros and cons and all of that. But if I could summarize it, I would say always ask questions, always get a second opinion or third or whatever you need, and always explore every option because maybe those options are ones that you're not going to pick, but you're going to have that sense of relief and comfort knowing that you explored the options. You're not going to have like regrets. Your loved ones aren't going to have regrets and things like that. And I think that's so important. And so many times patients are given incomplete or inaccurate information. And it's so frustrating because it shouldn't be that way.
Yeah.
The right doctor, the right private patient advocate, and the right treatment plan can make all of the difference.
Right. You know what, Elena? Thank you so much for sharing your story and this crucial information. This has been such an insightful and eye-opening conversation. And for anyone listening, if you or someone has been diagnosed with cholangiocarcinoma or another complex condition, Pathway Patient Advocates is here to help.
Thank you, Christine. It's been a pleasure as always. And I really hope this conversation helps our listeners feel more confident as they navigate their healthcare journeys because it's challenging. So, the less challenge we can make it, the better.
Right, absolutely. Well, that wraps up today's episode of Ask the Patient Advocate podcast. Thank you everyone for joining us today. And for more information, visit our website at pathwaypa.com or give us a call at 947-517-8395. We're here to help, and no matter what your situation is, enjoy the rest of your day. Bye.
Bye. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.